All right, and hello. Today is January the 10th, 2024. You're here for nursing news you can use at 5. I'm Tina Baxter, and I'm your host. Welcome to those of you that are on our Nurse Shark Academy show and those that are on our Facebook and the Nurse Shark Academy page, those on the Baxter Professional Services page, of course, those on YouTube, those of you that are on our website. Hi, welcome. All right, so I wanted to go ahead and hop in for today and give us our affirmations. And so we have the 2024 Louise Hay daily affirmation calendar given to me by Lori Brown, my business coach and mentor. And I want to thank her for this lovely gift. And so, because of that gift, I'm going to share these with you. So, I'm excited about that. So, on Monday, January the 1st, this was the inspirational quote that she had. And it was today begins a positive chapter in my life, the start of an exciting new year and adventure. I'm going to say that again. Today begins a positive chapter in my life, the start of an exciting new year and an adventure. And so that's going to be our affirmation for today. And my question is going to be to you, what is it that you are doing for 2024 that's beginning your new chapter of your life? What's your new beginning to be like? So those who've been following, you know that I just completed the Comeback Champion Summit, and you still have time to watch some of those sessions that are posted on the YouTube channel. Go ahead and check out your girl on our session on having your setback be a setup for your comeback, and we talk about your beatitudes. But those of you know that we also just at the end of December had our Kickstart event, getting ready for 2024, getting our vision and goals together and our intentions set to start off the new year. What is it that you're doing to kick off this new year right? And those who've been following, you know, I'm in the 31-day wisdom challenge, studying the book of Proverbs. And I'm enjoying my time there. And I've been sharing live on Instagram about what I've learned each day from each of the Proverbs. And so, my question to you is, what are you doing? What are your goals? What are your intentions for 2024? Go ahead and give us a share. Also, I want to thank everyone who's been with us for these many years. If this is what, about maybe the fourth year that we've done this show, because we started around in 2020, somewhere around there, just kind of going live about, the big P word that I won't mention. And so we were going live about that and finding your protective equipment and things like that. So now we've come into a new show that we're able to bring you some interesting articles that I happen on. So I want to put a call out to anyone. If you've got some interesting nursing or healthcare news that you want me to share, let me know, because as I say, I curate these stories every week. I pull them off the internet. I do those searches so I can bring them to you. And of course, I put the things that are interesting to me. So I want to make sure they're interesting to you. So let's go ahead and get into our news story. And I want to say our very first story, and I'm happy to report this. This makes my heart glad. I just put out the newsletter. So this update came right after I put out my newsletter. So I'll be putting out information on the newsletter for that too. So I'll put a comment in there to let you know. But that 60-year-old man that was missing from the St. Louis nursing home has been found. Yes, he has been found and found safe. So a 61-year-old man with schizophrenia who had been missing for more than 3 weeks. It's 3 weeks now since the St. Louis nursing home where he lived abruptly closed was found Tuesday about a mile away, according to authorities. Northview Village Nursing Home, the city's largest nursing home, shut down suddenly on December the 15th. As workers scrambled to prepare residents for transfer to other facilities and employees from other nursing homes arrived to take them, one resident, Frederick Carruthers, walked away from the building, according to the St. Louis Post-Dispatch. The Missouri State Highway Patrol said Tuesday that Carruthers was found at a local restaurant. A member of the public saw him and phoned the police. Sergeant Charles Wall of the St. Louis Police Department said the officers received a call Tuesday around 10 a.m. that Carruthers had been spotted on the 4900 block of Natural Bridge Avenue, about a mile north of the shuttered nursing home. When officers located him, Carruthers had no obvious signs of injury. He was taken to an area hospital for evaluation. So last week, the Missouri State Highway Patrol issued an endangered civil Silver Advisory seeking the public's help in finding Carruthers, who was among the 175 residents of Northview Village before it closed. So I'm just very glad that he was found and someone did report it in. So I was excited to hear that. Because I was fearing a tragic outcome for this gentleman, particularly since I know that the weather is cold. We've had snows in the area. It makes me very sad. So the Missouri Department of Health and Senior Services is investigating the circumstances surrounding the nursing home closure, according to a spokeswoman, Lisa Cox. She declined further comments, citing ongoing regulatory investigation. So we're going to keep an eye on what's happening there with that. But when that came out, that brought up this other question that I had, because this isn't just an isolated incident. You would think that, okay, this is a tragedy, isolated incident, but no, because this happened, something similar happened in Colorado Springs, Colorado, where a nursing home closed or was evacuated suddenly and no communication with the family. So this is happening yet again. So it says those impacted by the evacuation of one Colorado Springs nursing home due to an asbestos contamination say there remains a severe lack of communication about the ongoing situation. Families with loved ones who lived in the Kiowa Hills Health and Rehab Center in Old Colorado City say they were never even notified of the evacuation that happened on Thursday, January the 4th. And this is, again, becoming an issue. It's the same theme of no one's ever told us, we don't know where our loved ones are, etc. So it goes on to say that Keon Kelly was a resident at Kiowa Hills for the last 6 months. Her son, Robert Kelly, talked about his 93-year-old mother. He said, I went to visit her on Sunday and, was surprised to see that the whole building was evacuated. Kelly says he was not told that the facility had been cleared out 3 days earlier or had been told where his mother is. He says, I'm just kind of hoping my mom is okay because she does have dementia and Alzheimer's. And I don't know if she's, freaking out or, what the deal is. I just wish I knew where she was. Kelly also has power of attorney over his mother and is confused as to why he was never contacted. Kiowa Hills explained in a statement to KRDO 13 that residents who were sent to facilities in Denver and Pueblo, as well as multiple locations in Colorado Springs. That's where Jennifer Singer and 14 others remain as of Monday. So Singer says, if it wasn't for me calling my family, they would have never known where I was going either. There's no communication at Kiowa Hills whatsoever. She says residents were told they could take only one pair of clothes, or in her case, what she was wearing that day, before heading onto a bus to their new facility. Singer's roommate, Deborah Callahan, also spoke with KRDO 13 over the phone. She and a group of 13 are at a home in Denver. Both she and Singer say they have no idea when they'll be able to return to their rooms with all their belongings. Callahan says she initially heard it would take 30 days, but most recently heard it could take as long as 90 days. So Kiowa Hills explained in a statement that the asbestos abatement company has been hired to complete the necessary extraction of the material from within the flooring and the walls where it was found during a construction project. Due to the widespread contamination, Singer and Callahan said they have heard that the items in their rooms may have to be destroyed due to contamination. So, according to Kiowa Hills, this is their statement. They says residents' belongings are currently still at Kiowa Hills while we await direction from the CDPHE, which is the Colorado Department of Public Health and Environment, regarding handling of their personal items. The community's goal is to preserve as many of the belongings as possible, as we know how important they are to our residents. In the interim, we are actively working to procure clothing and personal items for each resident. So the 53-year-old Singer says she's also worried about her lungs, as the contamination was found on a floor that many residents used every day. Callahan, at 67, echoed the sentiment, wondering when she'll be able to get tested for the dangerous fibers in her airways. And so this is a scary thing. I mean, I understand that they had to do this once asbestos was discovered. They were doing construction. They had to do it. But there's got to be a better way to set up some sort of communication system so that these incidents don't continue to happen. Okay. All right, let's go into our next story. This is another story about a nursing home that we've been tracking some of these trends that are happening in healthcare. And one of them has been on the issue of pay and whether or not workers have been, frankly, cheated out of their pay, according to reports. So here we go. Attleboro Nursing Facility among more than 24 in Fed probe over pay. It's coming from the Sun Chronicle. And it says Garden Place Healthcare at 193 Pleasant Street, Route 123 in Attleboro, which has 133 beds, is among the nursing facilities in 21 communities cited in the complaint. The complaint charges that the facilities intentionally withheld overtime wages to at least 624 employees and failed to maintain accurate employment records. The action in the U.S. District Court for the District of Massachusetts follows an investigation by the Labor Department's Wage and Hour Division of the pay practices of Next Step Healthcare LLC and co-owners Damon N. Del Ano and William H. Steffen. During the period of time covered by the department's complaint, Next Step and its subsidiaries jointly operated and or managed at least 25 affiliated skilled nursing facilities, including Garden Place Healthcare in Attleboro, as a single enterprise. The department alleges at all of the employers' facilities in the state, they automatically deducted 30 minutes from employees' hours worked for meal breaks and regularly permitted employees to work through those breaks. So what's happening is that, and this is something that's we did all the time, right? When I worked in a nursing home and I worked as an aide, you worked for 8 hours. You were in the building for 8 hours, right? But you only got paid for 7.5 because you did not get paid for your lunch. So there was no paid lunch time. And you were not allowed to go over that 7.5 hours without permission. And so if you worked through your lunch and didn't get to take a lunch, you just kind of sometimes would lose that time because you had to justify why you had up to 8 hours because heaven forbid you ever went into overtime. I mean, that's just the way it was when I started out as a CNA. So it says, based on those practices, the complaint alleges that employers violated the Fair Labor Standards Act by failing to pay employees all wages due to each employee's regular rate of pay for all hours the employees worked, and failing to pay employees the required FLSA overtime rate for all hours worked over 40 and each work week. The U.S. Department of Labor will not tolerate employers who willfully deny their employees their hard-earned wages and violate the Fair Labor Standards Act, according to Maya Fisher, Regional Solicitor of Labor in Boston. This litigation shows that we will enforce the law vigorously to make sure workers are paid properly for all the compensable hours that they work. So in its complaint, the department asked to recover paid regular rate and overtime wages earned in overtime weeks from September 27th, 2018 through at least September 14th, 2021, plus liquidated damages equal to the amount of wages found due. It also asked the court to restrain the employers from committing future violations of the FLSA's overtime and record keeper provisions. So, of course, they reached out to Next Step, and there was no comment from them returned to the Sun Chronicle at this time. But yeah, so there you go. So that's some of the issues is that record keeping is important, clocking in, clocking out, that type of thing, and making sure that you're not working through your lunches and not being paid for it. Okay. And that article was also picked up by NBC Boston, which reported the same thing about next step help. Um, and so there's more information about that. There's nothing new, but there's an additional article about that. All right. So here's another one. This is from McKnight's Long Term Care News. And this is from a nursing home operator must issue back pay after abruptly ending shift differential perk. So this is another incident of issues with pay and incorrectly paying. So the National Labor Relations Board sided with the union's request to have shift differential pay reinstated and back pay issued after a nursing home's new owner unilaterally ended the incentive practice in August. The ruling illustrates a key potential pitfall operators need to avoid amid a surge of labor activity in the U.S. And this is one of the reasons why I cover this, because it's not just, let's boom 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 bash healthcare, but this is for us in healthcare as leaders to say, let's avoid these pitfalls when we're making these decisions about, selling it off the business. And what does that mean? You need to make sure you meet the regulations. Okay, so it says care workers at Twin Brook Healthcare and Rehabilitation Center had been paid an additional 1 hour per second shift work and 50 cents per hour for third shift work when owned by Guardian Elder Care. After taking over operations of the Erie, Pennsylvania facility in April, Twin Brook OpCo continued to pay this differential rate for several months, according to the ruling. In May, these rates were doubled and a further $2 per hour differential rate was added for weekend shifts. But in mid-August, Twin Brook OpCo informed employees that licensed practical nurses and certified nursing assistants would no longer receive the additional pay going forward. Twin Brook OpCo had previously negotiated a bargaining agreement with the Care Workers Union. While that agreement did not specifically mention differential pay, the NLRB agreed with the union's complaint that the unilateral pay change was not permissible. So the ruling says the respondent gave employees every expectation that the shift differentials would continue by including the payments and each paycheck from the time it purchased a facility until negotiations concluded and the agreement went into effect. The respondent violated the act when it abruptly ended the shift differentials without affording the union notice or an opportunity to bargain. And so that is what occurred. And so that is why they sided against them. It's because they decided to change the rules after they already set up a bargaining agreement and had already started paying them. The ruling orders Twin Brook to reinstate the differential rates, give back pay for time missed, and make employees whole for an additional cost they may have incurred as a result. So we'll continue to see what happens with that. Of course, Twin Brook did not respond to a request to McKnight's. So we don't have any update from them. Okay. So just another quick thing on healthcare news. I got a couple others right here. So this article, this is an opinion piece, and I want to make sure I bring that up. This is from the Washington Post, and it's an opinion piece, and I'm just curious to see what you all have to say. Let me know what your thoughts are on this. But it says private equity firms are gnawing away at U.S. healthcare. It's okay. So this is from Ashish Jha, who is the dean of the School of Public Health at Brown University, and he served as a COVID-19 response coordinator in the Biden White House. So here's what he says. Not long ago, a colleague of mine sold his small cardiology practice to a private equity firm. He started his practice in Florida nearly 2 decades ago, and when a purchaser first came knocking, he turned them away. He loved his independence. But soon he was persuaded to hand over the keys for 2 reasons. The price he was getting was very good, and he was happy to outsource the headache of running the business, such as managing billing, making sure there was adequate coverage for nights and weekends, etc. He says, my colleague is not alone. The number of private equity firms has exploded in healthcare in recent years, spending hundreds of billions of dollars to buy physician practices, hospitals, laboratories, and nursing homes. It's a trend that should have everyone's attention, from politicians to patients, because it can significantly increase costs, reduce access, and even threaten patient safety. And this is something that we've talked about on this channel before. So it's not like, we haven't discussed this before, but let's get into more what he has to say. He says, at first, little changed after my colleague sold his practice. He drove to the same office and cared for the same patients. He went home unworried about who was on call and whether they were getting the billing right. But over time, he started noticing small changes. The gentle nudge to bill more intensively for visits, to send more patients to the hospital for additional tests. Then he noticed more profound changes. His practice stopped accepting a major insurer in the area. The private equity firm negotiating the contract couldn't come to terms with the insurer, shutting out some of his long-standing patients. And that I have seen happen firsthand in a practice that I was with, I will not mention, that stopped taking certain types of insurance, which caused a problem for a lot of our long-term patients because they had to go elsewhere. And so this is happening across the country. First, private equity managed providers become more efficient, meaning fewer employees and more streamlined processes. So again, that's where we talked about this in hospitals, where they cut staffing to the bare minimum and beyond. Efficiency is not necessarily a bad thing. A lot of healthcare organizations are poorly run. But what often follows is more aggressive billing and more requirements for patients to get these tests done and the like, driving up healthcare costs. And so, according to this article, this is what it says. These firms often thumb their nose at consumer protection regulations. Recently, the Federal Trade Commission accused the firm Welsh Carson of buying up small and medium-sized anesthesia practices in Texas to gain so much market power it could charge insurers monopolistic prices, which are in the end paid by the employers and employees, not the insurance companies. So there's other studies that show that a study published in JAMA examined that more than 50 hospitals that had been bought out and found that they saw a 25% increase in adverse events, such as hospital-acquired infections or falls, than non-private equity-owned hospitals. And we talked about that in previous session, so previous newscast. So I just want to say that, yeah. So this isn't something that's new, something that we brought up, but this is something that we all should talk about. He says, while his colleague sold his practice private equity, has mixed feelings about what happened. He says, while his life got simpler, he worries he can't deliver the same quality care as he did before. Policymakers should be worried too. Without greater enforcement of antitrust rules and oversight of providers, our healthcare system will become even more expensive and quality of care will deteriorate. And so these are questions that we have and things that you need to ask, when you're choosing a practice, and you're seeing things, you have to follow with the insurance company. If they're in network, out of network, suddenly you find out your long-term medical provider is no longer in network. These things happen. And so this affects all of us. All right. So that brings us to this article. I just found this kind of interesting. This is other healthcare news. And it says, this is from Reuters, and it says the U.S. sets enrollment record for Obamacare plans. It says more than 20 million Americans have so far signed up for health insurance through the Affordable Care Act's marketplace for this year, the highest since the inception of the law. Over 3.7 million people who signed up for the 2024 plans are new enrollees, the U.S. Department of Health and Human Services showed. Today is a momentous day. A record number of people in the United States have health coverage through the Affordable Care Act's marketplace, more than at any point in history. The latest data represents enrollment through December 23rd for the 32 states using healthcare.gov and for the 18 states in the District of Columbia with state-based marketplaces. The law, also known as Obamacare, was former U.S. President Barack Obama's signature piece of domestic legislation. And while I think that's great because I think people deserve access to medical care, that also makes you think about the fact that a lot of health care and health insurance right now is being tied to your employer. And if you're not in the workplace and you don't have benefits offered through your employer, how do you get access to health care? And we've seen that a lot of the Medicare or Medicaid that a lot of the states had during the P word that I won't mention, um, they now cut back on those enrollees. And I had several clients that lost their Medicaid because they made $100 more than they should, right? And so there's this incentive then to keep you poor. So if you take a job that doesn't offer health care, these are things that we need to think about as a society. Why do we not invest in our own citizens to make them more healthy and productive when we do have the resources to do so? That might a little bit be more cost effective. I don't know. So these are just questions that I have. These are things that we need to be working out on the policy level. But if you have any insights or anything on that, go ahead and share them. Again, healthy debate. I just think that everybody should have the access to health care. I mean, people shouldn't have to mortgage their house to have basic health care needs taken care of. So I think basic health care needs should be taken care of across the board. That only makes sense. And maybe we can cut down on the costs. Maybe then you don't have these other competing factors. I know there's a lot more that goes into it. And I know that there's some people on there that's going to be ready to argue with me and say they don't want socialism. They don't want this. And I'm not asking for socialism. I'm just saying that there's got to be a better system that is equitable and fair to our citizens and help save us money in the long run as a country. So just a thought. All right, let's move on. Because here's our next story. Another study came out. This is from The Hill, and it says Americans overwhelmingly favor health care price transparency based on the survey. So it says new polling conducted by Marist for the nonprofit Patient Rights Advocate, PRA, found that 94% of adults agreed that hospitals, insurance companies, and doctors should be legally required to disclose all of their prices, including discounted prices, cash prices, and insurance negotiated rates across hospitals and across plans in an easily accessible place online. This result were statistically the same across political parties, age groups, level of education attained, income level, and region in the U.S. When asked if whether hospitals should be required to post all actual prices in advance of planned care, not just estimates, 93% of participants said they agreed with the statement. Since 2021, hospitals in the U.S. have been required to post the prices of all their services, drugs, and items provided to patients in a comprehensive machine-readable file or through a display of shoppable services in a consumer-friendly format. Hospitals have been slow to comply with this rule, with a little more than a third of hospitals abiding by the rule, according to the most recent analysis conducted by PRA in July. While most hospitals posted the prices online, the documents were found to be incomplete or unreadable. I'm not surprised. Excuse me. Hidden prices and non-binding estimates give industry profiteers power over patients, workers, and employer and union purchasers when they're not required to share prices. That can happen. So the PRA has launched a free online dashboard called the Hospital Price Files Finder Tube that compiles the available price transparency lists by state. So just to take a look at that, basically, yeah, we want to know what we're getting, what we're paying for. There's someone did a really cute video, a reel on Facebook that I happened to see. And I think it was the people that do the Southern, it's a Southern thing. And they were talking about the new cups. I'm not advertising any cups, but they were talking about the new Stanley cups, right? Everybody's talking about this new pink Stanley cup. I don't know why, but for some reason, that's just a cup to have this year. And so he mentioned, that, like, well, it's not like any other overpriced cup or whatever, and then comes out the $300 hospital picture, ice picture. I just thought that was so cute, accurate, and really sad all at the same time because you don't know what you're getting. If I always advocate for all my patients, I said, hey, you go into the hospital, you come out of the hospital, ask them for an itemized bill, go through it line by line, making sure that it's correct because what happens is things get dumped on there. We did that for my husband once. They wanted to charge him for respiratory therapy services. Respiratory therapy did not come up. He had his own CPAP machine. I set it up for him on a nightly basis. Respiratory therapy didn't do a thing. Okay. But they wanted to charge us for services that were not rendered. So again, go through that line by line. Okay. Making sure that you compare it with your EOB statement and you can dispute those things. So those are things that people don't want you to know, but yes, you can do those things. All right. So let me get on because I want to go to international news before we move on. So I got a couple of international news. One is coming out of Queensland. It's from the Daily Mail because I wanted to share, hey, there's some things going on. It's not just here in the U.S. and we got issues. Nurses, this is a worldwide issue. So nurses in Queensland who were stood down during the pandemic for refusing to get a COVID vaccine are being sacked despite the lifting of mandates. So basically, they were, for the better part of the word, laid off, as we would say here in the U.S., and now they're getting fired. So it says nurses in Queensland who stood down during the pandemic for refusing to get a COVID vaccine are being sacked despite the lifting of mandates months ago. Ella Leach, Secretary of Nurses Professional Association, was one of those who recently notified through a letter that she had been fired even though she is 7 months pregnant. She said, I should be focused on the joys of becoming a first-time mom, but it has been overshadowed by this whole process, according to Sky News Australia. When asked why the Queensland Health Department would continue pursuing employees who are no longer in breach of any vaccine rule, Ms. Leach said she felt the authority was doubling down on its position during the pandemic. In September 2021, all Queensland Health staff working in facilities where health care was provided were told they must be vaccinated for COVID. However, this directive was repealed in September 2023 by News Director General Michael Walsh. They're just trying to prove a point with this, Ms. Leach said. There's no sensible reason why they would continue this action. So, according to her former employer, Children's Health Queensland, said in a statement it is unable to comment publicly on the employment situation, including disciplinary action of individual staff. Employee disciplinary matters are handled on a case-by-case basis and governed by robust and equitable processes. Ms. Leach said she was aware some staff had been told they could reapply for their old jobs. She says they say they've been looked at on a case-by-case basis, but they are templated letters, and they insert what you've written back to them and say, even if we haven't addressed your concern, don't think we haven't taken it into account, she claims. Then they just terminate you. It's disgraceful. She says she's spoken to nurses who have lost their homes over this. And repealing the vaccine mandate, Mr. Walsh said wide-ranging advice had been submitted that informed the decision. This includes employee feedback, expert clinical advice, official immunization advice, and human rights assessment. So we'll see what happens, but this is something that's happening. It's not just the U.S. There are issues across the world with these things. And so that's why I wanted to share them with you. Because here we've got another one. This is in Morocco. And it says Morocco unionized nurses in Rabat Sel Kenitra region plan to strike and protest. It says so unionized workers, nurses in Rabat Sel and Kenitra region plan to strike on January 9th over a series of grievances, including low salaries and poor working conditions. The same thing that every nurse in the U.S. also complains about. Yes. Mm-hmm. Organizers have also announced a protest outside the Regional Directorate of Health and Rabat, I'm not sure how to pronounce it, from 11. More than 100 individuals could attend the demonstration. The strike will likely affect non emergency health services, and hospitals facilities will continue to provide emergency treatment. Increased security and localized transport disruptions are likely near the regional directorate of health in Rabat through the afternoon of January 9th. And so they said clashes between police and protesters could not be ruled out, particularly if demonstrators were overly disruptive or if they ignore police orders to dispense. So again, these are things that are happening across the world. It's not just happening here in the US. And this is why I continue to have such a platform, because I want people to know, one, nurses and healthcare workers, you're not alone. Your brothers and sisters are also experiencing this. And two, I want us to see this in a bigger picture. So, on a happier note, this is a story that is coming out of China. And so I just thought this was interesting and I wanted to share it. It says Shenzhen pioneers in allowing nurses to prescribe drugs and order tests. In an unprecedented move, Shenzhen, a city in China's, uh, I'm not going to pronounce that right, but I'm going to say Guangdong province, has become the first in the nation to authorize specialist nurses the ability to prescribe certain drugs and order diagnostic tests. This trailblazing regulation, which came into effect this month, aims to augment healthcare efficiency and lessen the overwhelming workload of physicians. According to the new regulation, only qualified nurses will be granted these prescribing rights. The prerequisites include a bachelor's degree in nursing, 5 years of experience, an advanced nursing qualification, and completion of a specialized training program. The nurses will be able to prescribe medications and order tests within their field of expertise in specialist nursing clinics or community healthcare centers. However, their prescriptions must be corroborated by a doctor's prior diagnosis. So there's a lot that goes into this policy. There's more to the story, but I just wanted to share this because I just thought it was interesting. Again, a nursing news, and it's across the country, so I across the world. All right, so that ends all of my. Oh, wait a minute. There's one additional story that I meant to pull up, and I'm going to do that right now. And I meant to add that. Okay, here I am. All right, something happened. I don't know what happened. All of a sudden, the stream went down, and I'm not sure exactly what happened. But I wanted to share this other story with you really quick. I was like making sure it was on there. I was like, what happened that we almost lost our stream? Okay, so um, there's another story that I wanted to talk about. Um, Let me see if I can find it real quick because I meant to bring it up, and it was just a really really scary, sad thing. Okay, yes. So it was about Congresswoman Eddie Bernice Johnson. Um, and I wanted to talk about this. Okay, so according to this is an article, and it was something that came out. Um, it's from CBS News. And it says family of Eddie Bernice Johnson to sue hospital for medical negligence. And this is something that just came out. The family of former Congresswoman Eddie Bernice Johnson plans to sue Baylor, Scott, and White Health, claiming negligent care at the hospital's rehabilitation center that led to her death. Johnson was known as EBJ, was a trailblazing politician who represented the Dallas area for decades. She died at 89 years old. So, according to the report, her son Kirk Johnson said his mother was a patient at Baylor Scott and White after she had undergone back surgery last September. When he went to visit her on September 21st, 2023, he says she was shocked to find her lying in her own feces and urine. According to Kirk, Johnson had been pushing the call bell and begging for help for an extended period of time, but no one had responded. Kirk couldn't find any nurses on the floor to help either. So he went to an administrator's office to find the person in charge. The CEO of the facility followed Kirk to his mother's room. By the time they got there were nurses and staff cleaning up the feces. Kirk said the CEO told him this shouldn't happen. The family believes that the incident caused Johnson's surgical incision to become infected a few days later. They say lab reports done on the wound at the hospital came back showing organisms directly related to feces. According to the report, the laboratory report leaves no doubt that the infection that killed former Congresswoman Johnson was caused by the failure of the staff at Baylor Scott and White Institution for Rehabilitation and Properly Care for Mrs. Johnson, and allowing her to have laid in her own feces, according to attorney Les Weisbrot. The point of notice is to give the parties involved a 60-day period to attempt to resolve the claim before a lawsuit can be filed. After the infected wound had to be surgically repaired, Johnson was moved to a skilled nursing facility in October and then to her home in hospice care in December. When asked about these claims, Baylor Scott and White sent CBS News Texas a statement. Congresswoman Johnson was a longtime friend and champion in the communities we serve. She is an inspiration to all. We're committed to working directly with the Congresswoman's family and their counsel out of respect for patient privacy. We must limit our comments. So I wanted to share that because that's been going around on the news cycle, and I want to make sure that that did not get lost. And so I guess that's going to end all of my news segments for right now. Again, I'm not sure about the disruption other than maybe it was when I mentioned another country, but I thought that would be a good thing to celebrate you all, whatever. But, you never know what happens in these live streams. But I want to say thank you for tuning in. Don't forget to like and subscribe and share our content. We have coming up on January the 20th. We have a renewal of our workshop. So we have our, so if you want to start a nursing assistant training program workshop, we do have that available too. And I can give you that information. I'm going to post this right here. Yes, how to start a nursing assistant training school will be coming up. That workshop, I'm excited about that. We're going to have our master class coming up. This is a workshop event. It's not a challenge this time. It's actually an event. So you need to sign up for that. Register as soon as possible because early bird pricing is going away and it will be going back to regular price. And so now is the time to set up for that. So I did go ahead and post that as well. All right. If there's nothing else, I'm going to say goodbye. Thanks for tuning in. And don't forget to like, share, or comment, and see you next week.